Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no coping. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you. Hey, everyone. I just wanted to thank my sponsors for bringing this podcast to you. It's October already, everyone, believe it or not. So we need to pull out all the stops. This is the dangerous time of year. This is the time of year when we all struggle, and we're going to more parties and there's desserts out and everything. So plan ahead, gethealth.com, health code. There's tons of recipes. As a matter of fact, I was surprised. I made a couple of them this weekend. There's some pumpkin spice. There's some pumpkin pudding you can make with all kinds of good stuff like chia. There's a ton of recipes there. So use that to help you get through. If you're going to people's house for a party or something like that, just bring some health code. You can make bars. There's tons of recipes. I was actually surprised by how many there are. There's lemon, there's all kinds of different stuff you can make, and they do a good job of educating. And also, while you're there, take a look at the blog. They have tons of great information. There's Dr. Bickman just gave a little blurb on creatine and how it's helpful. So there's a ton of great free tips there. So go to gethealth, GETHLTH.com to get educated and to, find some treats and things that you're going to like over the holidays. And also, while you're at it, my other big sponsor here is Keto Mojo. They're doing great stuff, tons of great education. You're going to hear a lot more about the GKI, the glucose ketone index, trying to keep that as low as possible and just keeping yourself in good health. And so during the holidays, especially, it's really important to check those ketones and check your sugar levels and make sure you're staying on track. And then also you're going to see a lot of stuff that says keto. And I will bet you when you see it in the store or at Costco and it says keto, it's going to throw you out of ketosis and make your sugars go high. So Keto Mojo is the lie detector test. They really help us to determine what products are good and not good. So go out and support these two great companies. They're great people. I personally like them, and they're bringing these stories to you. I couldn't afford to do this on my own, so it's good having good friends, and so please support them. And we have November and December, and this year is over. So thank you for listening. Thank you for support. Have a great day. Hello and welcome back to the Life's Best Medicine podcast. I have a real surgeon here, actually. Sometimes I can drag in some doctors, and I have a vascular surgeon, and a lot of respect. That's a tough. You have to be pretty dang calm and figure out life and not get. Oh, it's scary. Like, to me, that's like scary stuff, and so I'm glad I'm not. But I spent some time when I was at USC with the vascular surgeons and the trauma surgeon. It's amazing. It's amazing the kind of work you all do. So, Dr. Lily Johnston, welcome.
Thanks, Brian. It's really a pleasure to be here and to have met you recently at Low Carb San Diego, which we can talk about. And I'm really pleased to be here. Thank you. Thanks for having me.
Yeah, so glad to have you. I'm so glad we connected there. And I was like, oh my gosh, because we're seeing more and more vascular surgeons and uh, cardiovascular surgeons, and it's amazing that people are starting to step back and saying, what am I really seeing? So let's go way back to the beginning. How about, like, growing up? Did you always want to be a doctor? Did you just kind of fall into it? How's it happen that you go into medicine?
Yeah, so for me, surgery was an inherited pathology. Both my parents are docs, and So I kind of grew up in a household where talking about stuff, medicine, was really the norm. And I didn't realize until I got a lot older how weird that was, right? And how not normal and strange maybe most people would find that. But for me, it was a pathway that I fell pretty naturally into, right? I always loved science and the exploration and the discovery and trying to understand what was true in the world. So I fell into science, and then from there, medicine seemed like, a really practical way to apply that science and make people's lives better. And so I went into medical school and sort of followed the path.
Oh, and both of your parents, they were surgeons or docs?
My mom's an OBGYN, and some people would argue that OBGYNs aren't real surgeons, but I will tell you that my mother is a badass surgeon and phenomenal. My dad's a cardiac surgeon, now retired.
Wow, CT surgery. Those
Yeah.
are tough. And OB-GYN is one of the like when I did rotations, I was thinking, no way, I'm not doing that job. It was brutal. At USC, I mean, that it was hard. I mean, these people were up all night, and it seems like
Yeah.
nowadays everyone just schedules C-sections for lifestyle. Maybe I don't know. It just seems like that's become the new normal for OB-GYNs. They're not there at 3 in the morning delivering. They go, we'll do it at 10 o'clock on Thursday. Whatever. Did your mom see that trend happening or?
A little bit. She actually left the obstetrics part of her practice when I was just about 1 year old. And that was largely because my dad was a cardiac surgeon and sort of not terribly reliable as a parent figure. And so she decided that, between the two of them, she was the one who was going to be the reliable parent to both me and my older sister. And to do that, she left the obstetrics part of her practice, which was never her true passion. She really loved the benign GYN side of things. And I think because really she had this, crystal ball and had this vision, 40 years ago, that in fact, helping people manage their lifestyle was really the way to help them be well. Right. And so she had this opportunity to help people manage their diet and their sleep and their stress and do all of these things. And, her real bugaboo in her practice was chronic pelvic pain. But she taught me early on that there are things that surgery doesn't cut out pain. We can't make that go away, right? That's a much deeper, more central process. And so what is the origin of pain and how do we manage that? And it's usually not trying to cut it out. And so I feel really blessed to have been indoctrinated with this perspective really early that pain is not surgical, and there's a lot of healing that does not involve cutting something out or rebuilding something. And so that was a really fundamental lesson for me early in life.
And then, so what was your progression now? You go to med school, then how did you fall into vascular surgery? What was it that attracted you to that area of medicine?
Yeah. So my dad, as I mentioned, is a cardiac surgeon, and I kind of thought I was going to do cardiac surgery. I really, the thing about surgery that's nice is you get a problem and you have a really concrete solution to fix it, right? And that was very appealing for me and how my brain works, right? The idea of doing what my mom did and sitting in clinic for most of the day and doing all that didn't really resonate with me at the time. And I wanted this, quick fix. Like I wanted to be able to have a pathology and make this physical solution and, in between 2 and 8 hours, right, be done and like have it be all better. And that was how I naively perceived my surgical career. And eventually, as I sort of made it, I started in general surgery after medical school, and you rotate through multiple different surgical disciplines. And again, I kind of went into the specific training program that I did, thinking I was going to do cardiac surgery. But a couple of the vascular surgeons got a hold of me in my intern year, my first year of training, and said, "Yeah, but they just do 2 or 3 operations. Look at all this stuff we do. We're like in the neck and we're in the belly and we're in the leg and we're doing all these different things, and we can do it open and we can do it endo or minimally invasively and, all of this stuff. And how cool is this?" And they really mentored me and took me under wing. And I realized, in fact, that there was a lot of opportunity in vascular surgery to focus in different areas and have a lot of different procedures that you could do and different intensities, right? I mean, the cardiac surgeons, like every patient they have is super sick, and they all go to the intensive care unit, and it's sort of 0 to 100 and that's it. There's really no dialing it up or down. In vascular surgery, if you want less intensity, you can do more varicose veins and more dialysis access and more things that, have fewer emergencies and the cases are a little shorter sometimes. And if you want the intensity, great, you can be an aortic surgeon and do all of the terrible, awful, really long operations and go for that way. But I foresaw maybe having a time in my career where I wanted to turn that volume knob up or down a little on the intensity. And so for all those reasons, vascular surgery kind of became my choice.
Yeah, and then what happened? What area of vascular surgery were you steering towards mostly? Did you go towards the lower end of stress, like
No.
varicose veins and things like that? No, you went into the more intense.
No, I mean, I have this sort of adrenaline junkie piece of me that says you have to be the best, right? And you have to do the hardest thing possible. And that's really been something I've recognized in myself as I've gotten older as like maybe not a good thing, right? It always felt like something that drove me towards excellence and drove me toward improvement and getting better and being the best. But I think this drive for achievement and for performance and for success has been something in my life for a very long time, right? I went to prestigious academic institutions and went to the best, university I could get to, and then went to a medical school that was really competitive because I was out of state and all of these things, right? And all of those things made me feel better about myself, right? Because I've achieved and therefore I'm worth something. And so I have continued to drive my career as though it is directly related to my self-worth. And so for those reasons, right, I picked the most prestigious vascular fellowship I could find that does all of these terribly complex open operations that everybody else sends to this, huge, well-recognized facility so that we can take care of the like worst possible cases. And I learned an amazing amount, right? My training clinically was second to none. But the burden of those patients and the amount of disease they had and what we were being asked to do, right, that began to wear on me. And then I got out into practice, and my practice was not a big academic center, but we had really sick people with really bad pathology. And I started waking up in the middle of the night thinking, God, should I have done something different? Maybe I should have called them yesterday instead of, planning to see them today. What if I picked the wrong surgery for them? What if and like the burden of these people's lives and limbs, like on my shoulders, started to become really overwhelming. And so as much as this sense of performance and drive and excellence and be the best has really shaped my career trajectory to up until now, I'm recognizing that may not be the best thing for my health, right? That may not be the best thing for me and who I am as a physician and how I can best serve. So I'm starting to dial that back a little.
Yeah, that's there's all these trade-offs in life. I was scrubbed into surgery with one of the top cardiovascular surgeons in the world when I was at USC. And it was amazing because the guy, they were talking to him and they're making small talk during surgery because it's a lot of downtime and, waiting for things to get, you know, done. And so they were talking to him about his son, and they said, "Hey, how old's your son now?" He goes, "I think he's and he wasn't even sure how old his son was." And then they asked, "Is he driving yet?" I don't know. I think he's probably, and he had no clue. And I said, "Oh, are you divorced?" And he said, "No, why?" And I said, "Oh, never mind." I was thinking like, "Oh, he must not have much contact with him." But the reality is, in talking with him, I remember, I'll never forget because I said, what if you could do anything in the world, what would you do right now?" And he said, "Surgery." I was like, wow, like that's your life. Like really, he didn't know about his kids and wife. And I thought, wow, there's so much that you have to dedicate to. And I said, okay, I'll never be a surgeon. I knew I didn't want that life to just have my career be my whole focus.
Yeah.
And then so for you, and then I would ask you, along those lines, as a female going through training, what was that like? Did you have to feel like you had to prove yourself more than everyone else, or the people downplayed your talents and things like that?
Sure, being a woman in surgery is absolutely harder than it is to be certainly a white man in surgery. That said, I think that I chose programs where it was not totally strange, right? I chose programs in my training where there were women on the faculty that were very supportive and were good role models. But there's always something, right? There was, a recent study that came out and was published and publicized in The Guardian, but it talked about the amount of sexual harassment that women in surgery, especially in the UK, which is where the data came from, are experiencing. And it's unbelievable, right? I mean, as a medical student, I had a surgeon in the OR, compare the size of my breasts to the size of the patient's breasts, right? Like, and it was just something he said that he thought was really funny. And everybody else in the room just moved on as though that were normal, right? And like, that's wickedly inappropriate. There is no other environment, there is no other professional environment in the world where openly talking about, especially a trainee's sexualized body parts is normal.
Yeah.
Like, that's not okay. And everybody just like carried on as though that were, and he did it multiple times over the course of my rotation, right? It became almost like the daily joke in the operating room if we had a female patient. And it was just mind-blowing, right? And so it was that kind of
Yeah, it's
thing.
crazy. I mean, I had an experience where we had an introduction to medicine type thing, and there was a surgeon there. He was a general surgeon. We went to his house for dinner, and it was unbelievable. It was almost like, now looking back, it was like almost like it was a comedy skit or something. This guy was so arrogant, and it was incredible. Like, and so I remember, like, it's like you can imagine he had above his mantle, he had a big picture of himself on the, not his family, but a picture of himself above his mantle, right? Like, we're sitting there talking, and he's like talking about medicine stuff, and the fire log fell out of the fireplace. It was around Christmas time, and he told his wife, "Hey, go pick that up and put it back." Like he was sitting right next to it, and she went right next to him to pick it up and throw it back in there. The phone rings. He holds it up like this for his wife to come get it, it was incredible. But we were all going around introducing ourselves, and my wife, who is not in medicine, was sitting next to me, and so they said, What do you want to go into? What do you want to do?" and all this stuff as we went around. And when it came to my wife, he said, "Are you in medicine?" And she said, "Oh no, I'm in human services, things like that." And he said, "Good, women don't belong in medicine." And three-quarters of the people there were females. And I was like everyone kind of was stunned. Like, did I hear that right? Did he just say that? And it was incredible, like amazing. And when you hear stuff like that, you think, man, why that is it's incredible that we have this undercurrent in medicine that can be like that. You think these people are the most educated and understand life, and it's amazing.
Well, and now we have data that suggests just the opposite, right? We have now multiple studies that have come out recently that show small but very measurable differences positively in outcomes for patients who have female surgical doctors, right, versus male surgical doctors. A couple of studies have come out recently, and there was another series a few years ago. And, you can hypothesize about why that might be the case. We can't say for sure. But the data suggests that, in fact, if anything, we maybe even have better outcomes than our male counterparts. Certainly, we are not inferior, right? And that is very vindicating for those of us who feel like we may practice a little bit differently than most of our male partners and have a different sort of way of going about the healthcare game. But certainly, there's plenty of evidence that suggests we are just as good, if not maybe even ever so slightly better.
And it could be, that you have more caring, or that you go, okay, everyone's watching me, I got to perform, and all those things, where other people may get lazy with their techniques. So yeah, there's a lot to it. But I think it's the post-op care, I think a lot of times is what's really important. Like, following up, making sure everyone's okay, and engaging with family, all those things really make a difference in patient satisfaction and outcomes.
Yeah, and taking the time ahead of time before surgery to set expectations and to say, this is what, I think may happen, and these are the risks and the benefits. I mean, I certainly spend a lot more time preoperatively talking to patients and really, for cases that are elective, going through the risks and the benefits. And are you sure you want to do this? And is this, going to help you, right? What are your goals? Is this going to help you get further down the road towards your goals? Or is this, something that we're doing because somebody said you should, but, you don't have to. And I think that some of that also comes into play, right? If you're operating on people who really are invested in the outcome and who are motivated to have good post-operative care and wound healing and prehab and rehab post-operatively, like, those are the patients who are going to do better.
And I think, that there's so much to it, but the compassion side of it too. I mean, a lot of yeah, like you're talking about risks and benefits. So many people I've seen, they go for surgery and then the surgeon never said, "Oh, you're not gonna be able to exercise for 6 months after this," or "You're not gonna be able." They never told them what to expect, so they don't know, uh, you know, how long they should be laid up for. And I think the good surgeons will say, "Look," and they'll exaggerate how long it's going to take to get better. So if they get better sooner, they go, "Okay, look, you're ahead of schedule, you're doing
Right.
great." Instead of saying, "Oh, you're going to be great in 2 weeks," and then 2 months later, they're like, "Wait a minute, you told me 2 weeks, and now it's And I think preparing people for managing expectations, not saying, "Oh, this is going to be easy, just talk them into the surgery and you're going to love this, you're going to feel great the first day after surgery," which isn't true most of the time.
Yeah, absolutely. And setting very real expectations, right? For atherosclerosis, right? We are not curing this disease. We are getting around this one area that is narrowed or blocked. And, you're not going to run a marathon after this, right? You're going to improve the distance you can walk. Here are the goals, and we are going to try to heal the wound on your foot, or we're going to try to improve your exercise capacity. But this isn't going away, right? We haven't cured your disease. And there are a lot of things that we have to do before surgery and after to continue to, work on your global health.
Yeah, I think the hard thing for your career path is that, yeah, and this is what I experience a lot too, is you see the end stage, you say, "Oh my gosh, if we could have intervened 10 years ago or 5 years ago or worked on lifestyle." Now you're trying to open up blockages and fix things that those don't just happen in a day. It takes years and years and years of poor nutrition and lifestyle and stress and not sleeping and all those things. And so I could imagine that became an issue for you, looking, going, "What can we do to prevent this from happening in the first place?" Much like Jason Fung does as a nephrologist, saying, "All these people are in kidney failure. What could we have done to prevent them from getting here?"
Absolutely, 1,000%. And this is Dr. Gary Fettke's story all over again. But when I took my first job out of training, we were the amputation service as well as the vascular service. So yes, lots of people with vascular disease do require amputations, but there are other reasons for that operation, and we did all of them. And so I saw a lot of patients with end-stage diabetes who had foot infections that didn't necessarily have terrible macrovascular disease that I could fix, but nonetheless were at a place where the infection in their foot was so bad that it was lose the limb or die from the infection. And I worked in a very large, multi-specialty group practice that was ostensibly focused on primary care and prevention. And yet I was seeing all of these patients with A1Cs over 10, right, who came to me with these terrible foot infections and non-salvageable extremities. And it was just devastating, right? An amputation is not a technically difficult operation. And by the time the infection is so bad that, we're talking about life or limb, it's not a conversation that requires a lot of nuance, but it was just heartbreaking. It was heartbreaking to do this day after day and see the failure of a system that by all other measures is doing great, right? I would see these articles that our system was winning awards nationally for our health plan and for our care of our members. But my sort of lived on the ground experience was that we were still failing a huge number of people. And I got really disillusioned with it. And I got disillusioned with the idea that I was fixing this one area of narrowing or blockage, but I wasn't really making a dent in the overall disease progression for these patients. And, I had a woman who had a consultation with me for claudication, which is cramping of the legs with walking. And I had seen her about 6 months previously, a telephone consultation. And we had talked about, increasing her walking distance. And she, worked at a local gardening store and was very active and was really on board with all of that. And so I usually would schedule another follow-up. And so I talked to her in 6 months. And as I was preparing for our call, I was going through her chart and looking at her labs. And I noticed that her A1C had jumped from 7 or 7.5 up to about 12, right? It was well over 10. And I got on the phone with her and we were talking about her legs and all of this. And I mentioned the A1C and she said, "Oh yeah, I just, got off the phone with my diabetes educator and having looked at all the stuff they sent me, I actually think I'm doing pretty good with my diet. I don't really think I need to change a lot with my diet." And my jaw was just on the floor, right? This woman nearly doubled her A1C in 6 months. And her message from the diabetes educators was, "You're doing okay. We'll just put you on the insulin and put you on the medications and it'll be okay." And so immediately, like forget about the legs, right? We're done with the legs. I'm not talking about the legs. We spent the next 45 minutes talking about therapeutic carbohydrate restriction and the fact that, yeah, if you want to be on insulin for the rest of your life, you don't have to change your diet. But if you want this to go away, or at least go into remission, and that is possible, right? Nobody ever told her that was possible. Then we're going to change your diet, and we're going to go, meal by meal, bite by bite about what you're eating in the day, because that is how this happened. It happened because of what you put in your mouth, and what you put in your mouth can absolutely play a huge role in walking this back if you're interested. And she was absolutely interested, absolutely on board. And it was among the most satisfying, interventions I have had as a physician, right? It had nothing to do with a procedure. I never and will never probably touch her legs, but I hope that she is out there doing well and getting off of her meds.
So how do you go from being a vascular surgeon to start looking at metabolic health and, carb restriction, things like that? How did this switch happen in your brain? I mean, what was your aha moment?
Like most of us, I think it starts at a very personal level, right? I began this journey when I was in my vascular surgery fellowship, and I was about 6 months in, and it was a really difficult transition for me. I hadn't done quite as much of the vascular side during my general surgery training, and so I felt underprepared for the fellowship. And the fellowship was clinically, as I said, very intense. Our patients were very sick. The pace of procedures and cases was high. And the expectations of my fellowship were very high, and it produced clinically excellent surgeons. But man, it felt like drinking from a fire hose. And I wasn't ready. I was also studying for my general surgery boards and taking my general surgery boards in the middle of all of this. And, I was in the middle of Minnesota. I mean, it was just so much stress. And I had started drinking a little more, right? I wasn't ever problem drinking, but it got to the point where I was really looking forward to that glass of wine after work every day. And I got home for the holidays and was with family and friends, and was thinking, looking at myself and thinking, yeah, that glass of wine every day is showing up. Like, you're not 20 anymore. That's visible now. And so I gained a little bit of weight, and I was feeling anxious and tired and fatigued, and it was just a grind. Everything was hard. And my mom had this paper that she had clipped out of the New England Journal that was a deep dive on intermittent fasting. And she's like, hey, I started looking into this. This looks really interesting. Will you read this and talk about it with me? And so I read it. And then I started down this deep dive rabbit hole about metabolic health and fasting and carbohydrate restriction and all of these things. And I kind of just fell into the rabbit hole and really picked that up as something that I decided I needed to do for me, right? And I was reading all about people managing chronic conditions, including anxiety and anhedonia or low mood and fatigue, and having a lot of increased energy and an ability to go long periods without eating, right? Which for me was a big deal. I would be stuck in surgery for 6 or 8 hours at a time, and not always have time to eat between meals or before surgery or something like that. And so I was like, wow, maybe this is a thing that would be really good for me. And then shortly thereafter, I ended up on a rotation in the middle of South Dakota, right at the beginning of COVID. So we were shipped out there. We had a little apartment that we stayed in. There was really not much to do when we weren't working. And I found Low Carb MD podcast, and I found Peak Human by Brian Sanders. And I ended up just binging podcasts for hours and hours and hours, and really kind of going all in for myself with a ketogenic diet. And I felt so much better, right? And the wine just went away, and I didn't want it anymore. I didn't need it anymore. And I felt so much better. And then I learned more and more and more. And I thought, gosh, what about my patients? What wouldn't they benefit from this? Many of them. And so that's how it started. And it's been a journey ever since.
Wow. And that started from your own personal, trying to get your life better. And as a
Yeah.
doctor, as a surgeon, we should know better. And we start falling into those traps, especially alcohol is a huge deal. Especially with highly stressed occupations, and especially if you're a adrenaline junkie too, you kind of, being at such a high level, sometimes your body needs to slow down, and you think alcohol is a way to take the brakes off, or put the brakes on a little bit.
Yeah, that was it. And it was I feel really fortunate that I kind of recognized it as a trend, right? It was never really a problem, but it was a trend, and I wasn't pleased with how it was going, and I saw where it could go, right? And recently, there's a endocrine surgeon at Harvard by the name of Dr. Carrie Cunningham, who has gained a little bit of notoriety recently for a talk that she gave at the Association for Academic Surgeons. It was her presidential address, and it has recently become publicized again in an article in The Guardian. And she talks about her own struggle and her own addiction and the rates of this problem with addiction, substance use, mental health, anxiety, depression, including suicidality in surgeons, right? And it was perhaps the bravest talk I have ever seen given. There's a version of it that's on YouTube for anybody who's interested. And it is so powerful because she is so vulnerable, and she talks about her life and the struggles and being in recovery. And it is so vulnerable in a profession, and medicine in general, but I think surgery in particular has this air of invincibility, right? Like, we are fine, we are okay, whether we are or not.
And we don't need to sleep. We could be up all night. We could operate forever. And
right,
all those things we think we're bulletproof. And when a doctor gets cancer, they be like, other doctors don't want to be around them because somehow they failed the system, believe it or
yeah,
not. There's this
right.
mindset that we're not supposed to get sick, and we get sick just like everyone else, even maybe to a higher extent. If you look at the overall mortality for doctors, like, we die younger than the general population for sure, that we're trying to
Right.
help.
And so there's this huge disconnect between how we say we're doing, right? We're all fine, we're all doing great. And yet the surveys on burnout and rates of suicidal ideation and substance use, right, are enormous. It's clear that we are not okay. We are not happy. And so, we haven't talked about the current chapter of my journey, but I have transitioned a little bit in my life and in my practice. And as part of this transition, I'm exploring this idea of how medical training and our profession systematically disconnects us from ourselves and from others and from the world at large. And it's gotten to the place where I'm going to write a book about it, because I think it is so prevalent in our profession that we are disconnected, and it's hurting us, right? We are unhappy as physicians and as providers. And partly it's because we're not connected to ourselves, and partly it's because our patients aren't getting better either, right? It's this, as the functional medicine docs say, like the pill for an ill, right? You don't have enough time to do the lifestyle, so here's your pill. But people don't get better with that, right? They come back for their dose adjustment in 3 months or 6 months, and they still have hypertension, and they still have diabetes, and they still have atherosclerosis. And so this disconnection that we train into ourselves, into our profession, is literally killing us, right? People are anxious, and they're depressed, and they're burned out, and they're unhappy, and doctors are dying from suicide, from mental illness.
I think we're number two in the world right now, as far as the soldiers coming up from battle with PTSD, and then we're number two as as doctors, and surgeons even have a higher rate. So you start looking at that in nurses, and people in the healthcare field are so stressed, and we become a cog in the wheel. And that's part of the reason I left after 18 years standard practice. Go, look, I want to be able to sit there with my patient, like, so many, like on yesterday, or 2 days ago now, I had two patients go, "Hey doc, I gotta run. I got a meeting to get to." So because I got all the time in the world, but
Yeah.
it's so nice to be able to educate them and help them, and that they know you're there for them when they need you. Uh, there's really something to that, and so many doctors I talk to go, "Look, I don't have time to talk about the stuff you talk about. I've got 8 minutes. I can't talk to them about what happened in their divorce 4 years ago, or talk about what's going on in life now, or what their job is like." And it's really remarkable how also that we are so blinded to what we're doing. And one of my good friends, who was the best man at my wedding, uh, he called me one day, and I was leaving. I was it was in a really hectic time of my life, and he said, "Brian, do you know how long it's been since we had dinner together? 2 years." Right. And I was like, "Yeah, well, let me explain my life, blah, blah, blah. It's not anything personal." Because he sent me a text and said, "Are you still mad at me?" And I said, "Mad at you for what? I haven't been mad at you." And he goes, "Well, I haven't seen you for 2 years, man." And
Wow.
you could realize, like, wow, it's pretty crazy and he said, "If you were your own patient, what would you tell yourself?" And I was
Mm-hmm.
like, "Get out of this business. You cannot work 18-hour days and sleep 4 hours a night and have a life, especially as a female. I mean, because there's more demands on you than the guys like your dad could say, hey, honey, you take care of the kids and I'll be working and I'll be the breadwinner type thing. But it's not that easy when you're the female breadwinner, or when you're, thinking about dating and you're so busy and you go, I have no life. It's not worth it anymore.
Right. And so here I am at 39 years old, single with my cat. And, I looked around and thought, is this it? Right? Am I living my most authentic life? Because I have a cousin. Her name is Susanna. And in the late 20 teens, she was diagnosed with stage 4 breast cancer at age 28. And she fought valiantly for about a year and ultimately succumbed to her breast cancer in her late 20s. And, that obviously was miserable for our family and her sisters and her mother. And we remember Susanna fondly with every opportunity. And Susanna was full of life. She was one of the most vibrant people that I knew and had in my life. And I spend a lot of time now thinking about Susanna and what she would want for me, right? And can I live my life knowing tomorrow is not promised, right? Yes, I am doing everything I can for my health and wellness. And the more I learn, the better I get. And when I know more, I do better. But some of that is the choices I make about what I do every day and what I get up and how I spend my life. And when I looked around at my practice in Sacramento, I was, an hour and a half by plane from my parents. I had not much in the way of any other connection up in Northern California, no other family or good friends in that area. And my practice wasn't fulfilling in the way that I hoped it would be, because again, I wasn't really fixing people. I wasn't making a dent in their overall health to a large degree, or to the degree that I wanted to or felt capable of. And I looked around and I thought, is this it? Like, if I got hit by a bus tomorrow, would I be proud of what I have done so far? And I'm proud of what I've achieved. Don't get me wrong. And I wouldn't necessarily make different choices. I am here where I am today, and that's good. But tomorrow is another day. And how can I live according with my values? And my values include connection and joy and laughter and the time and space to breathe and experience the world. And I wasn't living that life. So I made a change.
Yeah. And I think that's such an important thing. You extend your life by saying, okay, look, let me look around, because what will happen is you'll be 49 years old and be miserable and beat up, and you're working tons of hours. Like, okay, I made a lot of money. What do I do with it now? I can't even, if you go on vacation, you're stressed to come back. That's exactly where I was. And I looked around and said, I'm jumping ship. I have to. I cannot stay in this, because I'm not going to be a good role model for my patients if I can't go for a walk and I can't just hang out. And especially as a surgeon, you got to be very clear. And if you're drinking every night to calm your nerves, you're stressed, you're tense, you got 3 more cases after this one, it's really it becomes a conveyor belt that you're just a factory, just patient in, patient out, patient in, patient out. And I see that happen to young doctors now. They're just like, they resent patients who want to come in to see them because they're so busy, and it becomes an adversarial relationship. It's horrific.
Well, and I was spending so much time trying to protect my energy and recover from all of these, and again, like, my patients were sick, right? Like, the number of conversations I have about end of life care with respect to peripheral vascular disease is enormous, because it is often a terminal process. And we have to have a conversation about, I can do an amputation for you, but you're not going to live longer. And based on what we're seeing, your life expectancy is 6 to 12 months. And, you tell me what is most important to you in that time. And for many patients, it's the first they've ever heard of that. But those conversations had on a daily basis, when again, there's more pressure and more time, less time to see more people, like, those are draining conversations. And then, people say, okay, no, I'm going to do it. I want to go forward with surgery. So you do these complex, long, high-risk operations. You get done with that at, 7 or 8 p.m. and you take all the drapes down, and then there's no signal. There's no blood flow. You got to go back in. you got to start all over and figure out
Oh
what
yeah.
happened,
I,
right? And so
I
you get
yeah.
through this, you get through to, you know, if you're not on call that weekend, right, you get through till Saturday, and I would just sit in my house or sit on my patio and like do nothing for 2 days, just trying to recover my own energy,
Yeah, just
go
not to
back
hear
and do
people
it
talk
again
to
on
you.
Monday.
Yeah, yeah, not to hear, and you're going back on Monday, so Sunday you're like, oh no, I'm going back again.
Yeah.
That's exactly what's happened to me. Is like, oh no, it's gonna be crazy. I'm gonna get yelled at on Monday, and and
Yeah.
I remember, I'll never forget. I was scrubbed into this another CT surgery, and they kept getting, they put the sponges and the gauze in there, and they count them, count. They would, because you can't leave it in there. And then this guy, they would take it out, and then we bled again. And they were trying to figure out, where's it coming from. I was so frustrated because it was hours sitting there going, oh my gosh, please just be white, stay white, don't turn red, please. And finally it stopped. But man, I mean, you can't just close them up with a bleed going on. You got to find this little tiny pinhole somewhere that's causing the trouble. And oh my gosh, it takes a
Right.
special person to be able to do that, because it's mentally, especially if you're supposed to be home to have dinner with your partner or whatever. It's just incredible.
Yeah, that's the fastest way actually to ensure that your surgery will not go smoothly, is to make plans, right? Like, you know,
Yeah.
plan to go to the gym for a class, or plan to meet your partner for dinner, or plan to attend something, you know, for your kids. If you make plans in the evening, I can almost guarantee you something will challenge that.
You
And
make
so,
plans, and then you're going to be called in on emergencies all the time. You don't have plans, like nothing happens. You're like, okay, now it's
right.
crazy how that is. Yeah. So you lose your life in order to like maintain some sanity.
And, you know,
So
don't get me wrong,
shifting,
patients were grateful for the time and the effort, and, you know, oh, thank you so much, you saved my leg, you saved my life, you saved my dad's life, and that's great, and I am happy to do that. That's my calling in life. But it was stealing my soul, right? I was not able to go out and enjoy the town that I lived in, right? And I felt like I didn't have the time to go out and meet new people and enjoy the restaurant scene, or date, or do any of those other things. Like, it was all about the job. And I was, as I mentioned, I was waking up at night thinking about patients, and it was just so all encompassing. And I felt like it was only one part of life. And when I was there, it was on fire. And every time I wasn't there, I was just trying to recover and be ready to get set on fire again the next week.
yeah, I think people listening, I hope this gives you a flavor of what your doctor's going through, what the system doctors are going through. It's like you're another cog in the wheel. And like you said, you get hit by a truck, and they go, okay, we'll bring in the next surgeon. Here you go. We'll put you in their spot. Now you're going to take over the cases. I have someone I ran into at the conference, as a matter of fact, and he says, I think he said he had four doctors. He was trying to get a knee replacement, and they all kept retiring. You go and
Mm-hmm.
they go, wait, the guy's supposed to do my surgery next month. Oh, he retired. Oh, he moved to a different state. Oh, he's doing something else now. And you're like, holy cow, it's crazy. Like the burnout rate of doctors and especially surgeons, and it's just so overwhelming.
Yeah. And, you know, I knew that as I left my practice in Sacramento, it was going to be an enormous burden for my partners. Right. And I don't want it to sound like there was something wrong with my job. It wasn't that job, and it wasn't Sacramento, and it's not, you know, to whoever's listening, right? It's not this doctor or that system. They are all struggling. Right. And since I left my practice in Sacramento, I've been doing some locum tenens work, which is like travel nursing, but for doctors. And I've been to other places and, you know, other systems that used to be fully functional. I had a nurse in the recovery room tell me, you know, I have not seen this hospital. I've been here for 35 years, and I have never seen it like this. Like this, we are so broken right now. We can't do anything that we used to be able to do. And so medicine as a whole is suffering, and it's failing. It's failing its practitioners, and it's failing its patients. And you know, we have to figure out how to take this back one step at a time, right? We can throw our hands up and say, well, we can't do anything. It's just broken. But I don't believe that. And I don't believe that there's nothing we can do, right? Just like health is never totally broken. There is always something we can do. No matter how sick you are, we can get you feeling 1% better. And I think the healthcare system is the same thing. And people are slowly coming to this place where they recognize what they have to do for themselves, right? And what my threshold and barometer for stress and energy leakage and all of these things are, it's different than my partner's, and that's okay, right? I am who I am, and I am still a good doctor and I'm still a good surgeon, and I'm not giving up on surgery either. I just need to come up with a way to tailor my career so that I can do it from a full cup, right? I am the best surgeon I can be when I bring my whole self, my connected, joyful, empathetic self to our encounters, and the cookie cutter practice of medicine in most places these days doesn't allow any practitioner to show up that way.
Yeah, this is the thing that I had to realize. I was upset a lot of time. I'm an easygoing guy, and I was like pissed off all the time. Like, why am I like annoyed all the time? Like, they didn't bring my patient back on time because I knew I was not going to get home. And then when I had to deal with insurance stuff and trying to get meds or surgeons, surgeries approved, whatever it is, it was just such a like everyone was against the patient. Like, I'm trying to help my patient here. Please help me here. And that frustration level. And what happened ultimately is I was in Boca Raton at a conference. And when I came back, I was booked for the next like 8 weeks solid through lunch, through dinner, through night. And I go, I have no life. And I was there till 2 in the morning trying to get my charts caught up. And I was so upset because I'm thinking none of my partners helped me. And then I realized they're all drowning too. They sent 5 of my people to the ER on from Friday and Monday. 5 people went to the ER that did need to go to the ER, but there was no one could get them in to see them. They would just go to the ER. It's easier. But
Right.
the ERs are overflooded too, and the people don't get good care in the ER because they're not there for an emergency. That's what they're supposed to for a cold or a cough. You're not supposed to go to the ER. So, anyways, I started realizing like all my partners were drowning too. They weren't bad people. They were just drowning. They're so busy. They don't think about, oh, I better help Brian while I'm drowning. No, they're like, I'm trying to get my own patients in and I'm working late. And when you start seeing the dysfunction that happens, and it was around the same time Kobe Bryant died too, and I was like, the guy was 41 and died. You know what I mean? That's what when we're killing ourselves going like that. You go, okay, I still got 10 or 15 years on Kobe Bryant, even though he was a multimillionaire. He probably had some great experiences in life, but that's 10 more years or 12 years or however many more we have that we could spend with family and friends and help patients and get those joys of medicine without being overwhelmed all the time.
Yeah. Yeah, I mean, we are not promised tomorrow. All we have is today, and this idea that it'll get better when, right? I spent so much, especially in my training, in my academic life, thinking it'll get better when, right? It'll get better when I finish my degree and get into medical school, and then I can really focus on what matters the most to me. And then medical school was sort of a letdown. I was like, well, it'll be better when I get to focus on surgery and residency. And then, residency, of course, is residency, and the surgical residency is nothing to sneeze at in terms of your lifestyle and your control. And then surgery residency was kind of miserable. Well, it'll be better. It'll be better when I'm in fellowship, and then I'll be really focused because you always make up a story about why it is you're unhappy in the present, and that story often ends with, well, it'll be better when.
Mhm. Yeah,
And
for me, I was like, I'll work hard the first couple of years, then I'll cruise, and I'm like, okay, now it's 10 years, now it's 15. Then what happened is because I was spending time with patients and the word got around, I was so busy because I had so many patients. I had over 2,000 patients, and I said, look, I can't provide good care for 2,000 patients who if you just think from doing an annual exam on those patients, that's you can't possibly do it. Plus the patients who are sick, plus do this and the paperwork and go to the hospital. And so when you start realizing the pressures that we're under, like it definitely made my hair gray over here and also took years off. And so you start looking going, not worth it. People go, you went into direct primary care to make more money. No, I've taken a pay cut, but I went for a hike with my wife this morning with my dogs, right? And I had coffee with my wife. In 18 years of practice, only on the weekends would I have coffee with my wife. There's no way in heck she's gonna wake up at 4 in the morning and have coffee with me, right? Those kind of things you think about, those important moments and those, birthday parties. You go, oh, I can't go to the birthday party. I got a big surgery I got to do. Oh no, I got to do this, right? You always have these things, and it was a joke. Like people would tease my wife and go, "Oh, you're actually like when I showed up somewhere." She goes, "Oh, you're really married," you know, because
right.
like they would hear about me, but was he real? We never see him anywhere, and it's sad. It really is sad.
Yeah, no, I was that person in my family too, right? You would show up to some family event, a wedding, a bat mitzvah, and like, oh, you're here. Wow, that's really great. Because for
And
years
then
I
you want
was
to sleep while
busy.
you're there because you're like, oh my gosh, I'm so tired. Don't ask me any medical questions. I need to go to sleep.
Yeah, right. And to be the one in the family that everybody makes excuses for because, oh, she's very busy. She's a doctor, she can't come to little events like this. And you realize, you know, those
Miss
are the
all the little
events that
events.
matter, right? Those are
Yeah,
the
yeah.
those are the moments in life that we cherish, right? And people talk about, making more money, but nobody needs the stack of green paper, right? It's what does money buy you? And most people, when you really dig down, it buys you freedom, and it buys you the freedom from going to the grind every day. Well, if that's 10 years from now, like, what have you really bought? And what if you get sick between now and then? Or what if the love of your life dies between now and then, or you never meet them because you were so busy working? I mean, what are we trying to achieve? The nice house and the pretty car and all these things, like, those are just things. They don't, for me, they don't bring me joy, right? Having a peaceful home environment does bring me joy. So I will spend some more money on where I live to achieve that, because that matters to my daily personal experience. But it's not about being in the right zip code. And it's not about, keeping up with the Joneses and having a car that is as good as everybody else's. Like, it gets me from one place to another. I don't really care. But it's these.
Yeah. And I spent years trying to figure out how to, my sanctuary was my home, my family, my kids, my dog, whatever, just throwing the ball in the backyard, whatever. Just slow down. And the thing was, I was so busy, I didn't have time to do that. I'm like, that's my favorite place to be, but I can't be there. Right. And you go like, what am I doing? If I can't be at the place I want to be, it's like, it's really amazing. And I think, I remember resenting some of my patients because like they come in complaining, they're all down. And what's wrong? I worked 50 hours last week. I was like, I'll trade you. I'll take 50-hour work weeks any day of the week. And you start realizing how much time we put in, how much effort. Plus, not only that, like in your career path, the reason I didn't choose it is that whole thing is like you're up to going, oh, once they have a bleed, when does this happens overnight, just a surgery day. What about, you start second guessing and worrying about the patients and worrying about stuff a lot. And you can't have peace in that. It's hard to just relax and go, okay, I'm just gonna sit here at the beach when I know how much stuff I got to go and there's sick people in the hospital dying. And it's really, it really does tax when you care. But I think what happens to a lot of people, they stop caring because it's too painful. And that's where I didn't want to go. I didn't want to be there at that stage.
Well, and they don't have it in them anymore, right? They have just been, the compassion fatigue, right? You care, and then people get sick and die anyway, or they won't participate in their own healthcare, whatever it is, or it's just, it happens so much. There are so many sick people now that you lose the ability to extend yourself that way. And I would find myself having that in clinic as well, right? I'd be seeing somebody with a quote unquote minor problem, which in the grand scheme of things that I treat, was it life-threatening? No. Was it limb-threatening? Still no. But for that patient in that moment, like, that's what really mattered to them. They made this appointment weeks in advance to come see me to talk about this, thing. And I could not muster the compassion to meet them in that moment and say, I'm so glad this isn't limb threatening for you, but it sounds like this is really impacting your quality of life. Let's talk about that, and let's see how we can help. Right.
So what are you doing now? What are you transitioning to now? I have to ask you that. I have to ask you two questions right now. One thing that's been in the back of my head this whole time, your dad, a thoracic surgeon, when you started talking about low carb, and was it like a hard sell for him going, wait a minute, what are you talking about? We should all be vegan and low fat, right? Obviously.
My dad was never much into the vegan side of things. He never met a vegetable that he thought was a really good idea, but he also was never, the nutritional literature never interested him much. And so he has been a very interesting case as I have gotten really involved in this, because he's had his own health challenges. And that's really a big part of this story for me. When I was in fellowship, after his, decades long career being a surgeon and being in an ergonomically challenged environment, he began to have back problems, and he began to get lower extremity weakness to the point where walking was difficult. I mean, my parents, for a period of time, lived in Virginia, and they lived on the top floor of their apartment building, which was 26 stories or something. And my dad would walk up 26 flights of steps after working out in the gym, right? That was kind of his finisher. And it got to the point where he was getting weak and he couldn't really do that anymore. It wasn't so much a pain thing, but he was getting to the point where his gait was really altered. And he was concerned that if he didn't address this, he might end up wheelchair bound. And so, my dad, over many years, developed Johnston's rules of surgery. And the first rule of surgery is that surgery is for other people. And he violated his own first rule because, he was not willing to sort of progress with this nerve compression to the place where he couldn't walk anymore. So he underwent a multiple surgery, multi-level repair in his lumbar spine my first year of fellowship, and did okay for a few months, and then had just a terrible complication. He developed infection in the bone at the level above his repair. And this was in the middle of COVID. So he's in California now, sort of trying to recuperate, but getting so sick. He couldn't eat, he couldn't get out of bed, and needed multiple surgeries. So now he's 5 operations into all of this, and his back is to a place where at least he's ambulatory. But at 80 years old, after 5 general anesthetics and a big systemic infection and suppressive antibiotics, probably lifelong now, his health and especially his cognitive function isn't what it used to be. And I've been watching this happen now for the last several years. And it's to a point where it's a pretty big stress for especially my mom, who is still working full time from home and doing her consulting business. And to watch my cardiac surgeon dad get to a place where, he can't remember where the restaurant is that we've been going to for 15 years, that's a mile down the road, has been a real challenge. And my dad is really resistant to changing his lifestyle. Like my mom and I, from that intermittent fasting article in the New England Journal 5 years ago or 4 years ago, what it's been now, she and I have both been keto or low carb and doing some intermittent fasting and sort of, doing Dr. Ben strength training and balance training and zone 2 cardio and like all of these things, right? We do this together. And she's been an amazing partner on that journey with me and our N of 1 experiments with each other. But dad has never gotten on board. And to know, I've watched his visceral fat accumulate over the last couple of years, and he's drinking a lot more alcohol than he used to. And we've talked about it. Like he knows his brain isn't quite what it used to be. And we've talked about these things. And he says, I'm 80 years old and I didn't really ever expect to live this long. And from my perspective, right, like there are things that might make me live longer, or maybe they'll just make it feel like it's longer. And I'm not interested in that.
Yeah, it's a hard thing. It's a hard sell. And that's why I was curious. I didn't know your dad's story. I'm so sorry to hear that too. And I see that in my parents declining slowly mentally and physically. And it's hard. It's really hard to see someone that super active, super fit. And you're like, okay, I don't want that to happen. And so part of it is us changing what we're doing and saying, okay, what can I do to make my life better? And then, my family not have to take care of me and all those kind of things, and I think it's a hard thing because someone has all these things in medicine have always like perplexed me in a way where, for me, I spent years trying to get more efficient. How do I see more patients in a faster manner? But then you lose your effectiveness by being more efficient. So you go, okay, this doesn't work. And either I can see you really quickly and get you through and get you through and get you through, and then you can see me sooner, but you won't have the quality of time, or I can give you the quality of time, but it's going to take you longer to get in. We shouldn't have that struggle in life. We should be able to have some time where we go, okay, I have some downtime to put someone in who needs to be seen, because it's really something. And the other thing I remember, a couple of years ago, after practicing for a long time, one of my wife's cousin had a horrific car accident, ended up dying from her injuries, but severe burns. And I remember going to the burn center thinking, how can you possibly do this job? It's horrific what they have to do. It's torture. It's horrific. And I was like, either you have to turn off your humanity or you're going to lose your mind. You cannot do this every day. Like seeing such suffering and knowing that most of these people aren't going to live. It's such a hard thing. And we went into medicine to help people, and we realized, okay, we're just going through the motions now, and you kind of lose your humanity. I'm so glad that you're realizing that at a young age. I would say at a young age compared to me, but it's hard because of the years and the dedication that you go through. You go, okay, I can't just hang this up and do something else. And that's why a lot of doctors are killing themselves, because like, what else would I do?
Right.
And that's a hard thing, because that your whole life has been dedicated to this calling.
Yeah. And so, I, again, sort of took a life inventory and was thinking about my dad and then my mom, who's supporting him, but as otherwise, doesn't have a lot of support structure here in San Diego, and was thinking about my practice in Sacramento and how that was going. And was that, this organization that is primary care and prevention focused with all of these members with an A1C over 10 and telling their member with an A1C of 12 that she doesn't have to fix her diet and all of these things. Like, is this where I'm supposed to be? And the answer was no. And so I made a difficult decision to give up my practice in Sacramento and leave my partners there and move back here to San Diego. And I went to medical school here. So I've been here before, but mostly I'm here because my parents are here. And, I don't know how much time I have left with my dad. And my mom is one of my best friends in the world. And this is where I need to be, right? Of the people who need me in the world right now, it's my parents. They need me the most. And this is where I need to be for me. And as much as my job in Sacramento had pretty reasonable work-life balance for a surgeon, it was not enough for me to be here every weekend or even every other weekend and be seeing them. Because again, as I said, I was too busy trying to recover from my own stress and anxiety within the practice. So to get on a plane and come down here and then deal with mom and dad it was too much. And so I left that practice and I'm now here in San Diego. And for now I am doing sort of the travel doctoring thing a couple of weeks a month and doing vascular surgery on that front. And in the meantime, I'm trying to figure out what a metabolic vascular surgery practice looks like. Right. And I'm trying to figure out how to do that through a lens that includes therapeutic carbohydrate restriction, but also some of the lifestyle medicine principles and, incorporating stress management and nutrition and food as medicine and movement and sleep and connection, and really diving deep into these things that are truly healing for people, because it's what's healing me, right? I started with nutrition, but I also came to the place of recognizing that if I am not sleeping because I'm on call all the time, or I'm worried about being on call next weekend, or I'm waking up in the middle of the night thinking about my patients, I've worn the CGMs too, right? Like my glucose is totally out of control when I'm not sleeping, no matter what I'm eating. And it's not sustainable. It's not well or healthy for us as providers. And so I am currently going through the Nutrition Network Certified Practitioner Program. I recently did my SMHP, or Society for Metabolic Health Practitioners, accreditation. So I'm now official through SMHP. And I'm working on some functional medicine training too, because I think that all of these tools are so important in our patients with bad chronic disease, right? And some, like my dad, will decide that they're not ready to make those changes, maybe never. But for those patients who are, we need to give them the best information, because most people that the medical system labels as non-compliant have been incredibly compliant, right? And I think you and Dr. Tro taught me this. Like, they have just been told the wrong information. They have been bending over backwards for years trying to do exactly what we told them. Eat less, move more, skim milk, right? And it's failed them. And if they, God willing, are still able to come to us and say, I'm willing to try again, then we have to show up with the information that will actually help them move the needle and get well. And you and Dr. Tro have also shown me that people do get well when they put these practices into action. They get off their meds and they find their energy and they find their joy in living again, and they connect to their families and their friends and their communities. And if that is not what we all are aspiring to do and what we set out to do when we showed up for day one of med school and put on our little short white coats and took our Hippocratic oath, like, I don't know what is. So that's what
awesome.
I'm trying to figure out.
That is awesome. Yeah. Now, are you now taking consults? Can we send people your way? How do we work together? How do we get people to you to know about you?
So I am, licensed in a few states, and I am still working on this from a metabolic health standpoint. My passion is obviously in patients who have cardiovascular disease, right? And I think that there's a lot of nuance about, what kinds of medications for management, or how are we going to manage lipids if you're going to be therapeutically carbohydrate restricted and your LDL goes up a little bit, your LDL-C, like, are we going to worry about that? Should everybody be on a statin, right? These are the tough questions. And the short answer is that it depends. I think that I have a nuanced view about that, but yes, I am working on opening up the metabolic practice, and I'm certainly open for consultation here in California. And again, I don't necessarily have a vascular surgical practice here. If you need an operation, I don't have a great vehicle for that just yet, but I'm working on it. But for metabolic health things or for cardiovascular risk management, that is absolutely something that I am open for.
Yeah, awesome. And because I know people varicose veins, if we could figure that out. I mean, I don't like any of the centers I send people to right now. So I would love it if you ever go, okay, 2 days a month I'm over here. One day I'm doing this. So we could figure that out. But I think getting patients to you who are really concerned with regard to vascular health, like, okay, everyone says I need a statin. Do you think I need it based on your experience as a vascular surgeon and as a person? I think there's so much, and like you said, it's nuance. You look and you go, okay, what's best for this person, and how do I prevent them from violating dad's number one rule of not being the person who's getting surgery. I think
Right.
that's the thing, is we have to look at that and figure out our path forward in life. That's the critical stuff. So if people want to track you down, is there on social media, is there any place where it's a good connection point for you, for people who want to get
Yeah,
advice from you or
LinkedIn
talk
is
to
the
you?
best way to find me right now on social media. And then the website is under construction, but you can certainly find me by email at I am at Lily at vascularhealthinstitute.org. All one word, vascularhealthinstitute.org.
Awesome. And there's one L in Lily, so we don't
Yep.
screw it up.
Lily,
So
Vascular Health
and
Institute.
we'll put a well, actually there's two L's in it, right?
Yeah, two,
But
not
not two
three.
together at the end. So, anyways, yeah, great. Because I think people need a resource, and so many people will say, "I want to talk to an actual surgeon who understands this stuff." I know Philip Ovadia. When I met him, I was laughing because I was at a conference in Boca, as a matter of fact, and he had this huge plate of steak in front of him. I was joking. I didn't know who he was. I go, "Your cardiologist must love you, huh?" And then he goes, well, yeah, I argue with those guys a lot. He's a cardiothoracic surgeon, CT
Mhm.
surgeon. So I was like, wow. And he goes, I've never done surgery on people with normal insulin levels, as far as multiple blockages and all those things. You start thinking about it. These people with experience like you know what was causing the root cause of all these problems, and addressing the A1C and insulin and all these things, and just having someone in patient's corner who's I would put you in the class of Gary Fetke and some of these other people who, by helping people, you hurt your own business to a degree, right? Because you're not doing the amputations and revascularization where you make all this money, but saying, hey, look, we can prevent you from getting to that point, or reverse some of this maybe. And so yeah, I think it's such an important thing. And I'm gonna play this one on Low Carb MD and Life's Best Medicine. I think it's that important that people hear, not only just from the lifestyle point of view, and how as docs and surgeons, or what we go through, what you've been through is way more dramatic than what I've been through, probably in training, because I know the hours you put in. But um but then finding your way and saying, okay, what matters. And I think this is an important lesson for everyone, in that um we have to reassess where we are in life. Like, is that working 80-hour weeks and you don't know who your kids are anymore, and all those things. Like, ultimately, as you get to your dad's age, you need to have kids who love you and care about you, and family and connections and all those things that we forget about. And even looking at cardiovascular risk and heart attacks and all this, what we find is one of the biggest preventive measures for that is relationship and friendship and laughing, and lowering down those stress hormones a little bit. And we forget about that.
And I think it takes all kinds in the world, and there is amazing camaraderie in an OR environment. For example, it's a truly unique place in a hospital, but also in the world. And if you take your inventory of your life and you find that your highest calling and the place you are supposed to be is in the OR 70 or 80 hours a week doing that, then thank you, like, bless you, and please keep doing that. This is not to say that surgery is the wrong choice for everybody, and that lifestyle is the wrong choice for everybody. It's not. And if that is your highest calling and where you belong and how you best serve, great. And I'm so grateful for that, because again, it takes all kinds. For me, that is one place where I can move the needle, because again, I really believe that the compassion, the empathy, and the nuance I can bring to those conversations is a big deal for some of my patients. And I also need to move the needle in the cardiovascular risk space by talking about metabolic health and talking about the fact that surgery is not a solution, right? It is a Band-Aid on a hole in the Hoover Dam. It is not fixing anything. And so my highest calling is to keep in the vascular surgery space, because that's where I thrive clinically, but also to really build this bridge into the metabolic health space and connect those two dots and be well myself, because a full-time 80-hour-a-week surgical career for me was hurting my health and hurting my connection and my restoration. And for me, that's not the right answer. So, it takes all kinds to move us forward.
That's awesome. And I saw that in you when I first met you there at the conference. That's why I'm so glad you joined me here, because, there you can't train in compassion and kindness and being genuine, and that's really, really critical to being a doctor, really. I think that's when you cut it all out. You have to know what you're talking about, clearly, but being invested, saying, okay, I'm going to figure out this problem. I'm going to help this patient as much as I can. I'm going to educate them as much as I can. I will take the time to do that. But when you have 300 patients you're seeing that day, you just can't spend too much. You just don't have the time the bandwidth, it's impossible to do that. So I have to ask you, what's life's best medicine for you? Like, now that all the life experience you've had, and I think us docs might have a different perspective because we see death and dying like in our training, and so I think we're more in tune than the general person just going through life. So in the final analysis, when you say, okay, let me reassess, and if I'm here and I really want to impact people, like, what do you do when things are tough? What's life's best medicine for you?
I think life's best medicine is love and connection, right? And that is both with other humans, but it's also with nature and the world and beauty, and just finding that joy and laughter and connection. And when everything else is, the number of people that I have met on their deathbed who are still able to crack a joke, and we are crying and we are laughing. I think the valuable perspective of some of those patients, what they have taught me is you never get another chance to go back and hug the people that you love and to enjoy one more sunset or one more walk among the trees. And so whatever else is going on in your life, if you can take 5 minutes and call a friend or talk to your son or take a breath of fresh air, go downstairs and walk out the door and just take a breath of fresh air and acknowledge the sunshine, or the moon, depending on the time of day. But get that love, get that connection, and find your joy.
Awesome stuff. Thank you so much. I mean, people listening, you're going to want to go back and listen to this. There's so much in this. I mean, we covered so much territory. Like, it's like a marathon right here in this little hour, but it's critically important. I hope this helps you to reassess. This is why I did this podcast, is to really help us determine what really matters and what's important. And do I have to have the nicer car than my neighbor? Does that really, really ultimately matter? Does anyone die and they go, oh gosh, he had the best car in the neighborhood. He was a jerk, but he had a really nice car, and all these kind of things. And so, about family and parents getting older and you can't have the time back. And, these are all really critical lessons. So, thank you so much for your support and for listening. And, please share this with docs, and people, because it's devastating that our best and our brightest, our most compassionate, are killing themselves at such a high rate. And we really have to step in. We have to figure out how to fix the system. And having doctors like Lily here, who are saying, look, we got to fix this problem. And so it's so great to have you, and I'm honored to have you. And I'm really looking forward to your book when it comes out. I want to be the first one to talk to you about it, and I'll be the first one to read it. I really think it's important. And I'm happy about what the transition you're making in career practice, and still doing some surgery, and then really working at preventive. So people, if you're looking for a good doc who understands, there's a person who has been through the training, and it will give you some great advice. So
Brian,
be kind to yourself, be kind to others.
Thank you so much. I appreciate you. Take care.
Oh, thank you so much. We'll talk soon.
Okay.
Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify, or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.